Hi there, and welcome to Abroad with Care, the 10-minute podcast that makes health easy for expats in Asia. My name is Andrea, and every day I help expats make the most of their life abroad. With this podcast, you will finally get the practical answers you need on budgets, hospitals, maternity, and many more topics. Twice a month, leading experts will share advice and tips to help you protect yourself and your family. This podcast is created in partnership with April International, a leading insurance services group supporting expats when it matters. Many expats who have moved to Asia decide to build a family or grow their existing one. The topic of maternity or parenthood can be quite daunting, especially for new parents outside of their home country. In this episode, we will address one of the key questions of parents-to-be: how to choose between private and public hospitals when giving birth. I'm delighted to welcome Rosie Adams, registered midwife working at OT&P Healthcare in Hong Kong. But first, let's hear Aude's story. Aude had her first child last year during the pandemic in Hong Kong, and she chose to have prenatal checkups in a private clinic, but to give birth in a public hospital. She explained to us why she was pretty happy with her decision.
So I had my baby in June 2020. So it was a bit of a strange experience because it was COVID time. So I decided to give birth in a public hospital. To be honest, the main reason for it at the beginning was that I didn't have any insurance, so I didn't have anything to cover the private hospital. I was a bit afraid, of the language barrier. So I thought maybe the nurse, their English wouldn't be so good. So if I had any question, because it was my first baby, I was like, are they going to be able to understand my question and to answer my question in a way that I understand the answer? And honestly, it was there was no problem at all. Everybody was speaking a very, very good English. If you want to deliver in a public hospital, you need to do some checkup in the public hospital before the birth. So I did this mandatory checkup at the public hospital. And then I also did a bit of follow-up with a private doctor. I think it's really a choice that you should make, whether or not you have enough money, because in the end, going private costs a lot of money. And whether or not you want the ultimate comfort, or you're okay to be in a public ward for a few days or a few hours. And also I think something that's important to know in Hong Kong is that all the materials, the best materials and the best doctors, are in the public hospital. So if anything goes wrong in a private hospital, you will be sent to the public hospital anyway. If I was to do it again, I would do it the same way. So I would do the follow-up, a mix of private and public, but I would give birth in a public hospital.
Hi Rosie, thanks for joining us today.
Thanks for having me.
When it comes to prenatal and birth care, choosing between a public or a private hospital is a very popular debate for parents-to-be, such as Aude. So before we discuss this more in depth, I think we should just take a step back, as it's quite important to discuss what level of medical care an expat should expect when giving birth in Asia.
I mean, with Hong Kong and Singapore specifically, we are very lucky actually to have access to a public healthcare system that is of a very high standard of care. The care is very safe. The practice is all evidence-based. Here in Hong Kong specifically, a lot of them are teaching hospitals. So, you've got a lot of physical support there that's very, very safe. So I think that offers a lot of reassurance to people when they're considering options. We are fortunate enough to have choice, which I think is so important for people with, in different circumstances and different considerations for their care.
And it's also really key to understand the pregnancy and parenthood culture in Asia. So what would you say are the key traditions and beliefs?
I would say, from speaking to clients, the main thing that comes up really is the communication aspect of the care. In Western medicine, it's very much about open communication, informed choice, discussing concerns openly. Whereas in Asia, clients have come to talk to me about the fact that they operate on a no news is good news approach, which is great in some ways because they're doing all the checks they need to do, but especially when it's your first child, that dialogue and that communication I think is so important. And sometimes there's not, I'd say more so in the public system, there's not the time and the approach. They would say they're prioritizing the the physical aspect of the care more than the perhaps emotional side or the communication side of things.
Interesting that you've mentioned the communication style differences. What could you say about prenatal care? What are the differences between using prenatal care in the public and the private sector, possibly maybe in Hong Kong and Singapore?
Yeah, so I think both Hong Kong and Singapore do operate very similarly in the fact that in the public system, you'll be, depending on which hospital you deliver in, you'll be allocated either the hospital clinic or an external clinic where you'll go for your antenatal appointments. There's no continuity of care, unfortunately. You'll be seeing a different face every time. The wait times tend to be quite long and the appointment times themselves quite short. So we regularly hear of maybe a 2 to 3 hour wait for your antenatal checkup. And then once you do get in to see the midwife or to see the doctor, you're out within 5 to 10 minutes at the most. You don't have that same kind of sense of familiarity and comfort that comes with seeing the same face, and that continuity we know has such a positive impact on women during their pregnancy and beyond. So I would say that that's the flexibility, the wait times, and the lack of continuity are the main things that are discussed in the public system. Like I said, all the checks will be done to a high standard, but comparatively in the private system, you choose your doctor. So you'll have your choice of your obstetrician, lots and lots of different obstetricians to choose from, different approaches, different personalities. But you do have the freedom there to opt for somebody who you think is the right fit for you.
You've discussed a little bit about prenatal care and what to expect there. What could you say about birthing plans? What are the key differences between giving birth in a public versus a private hospital?
I think a good way of approaching this type of thing is birth preferences, meaning that labour and birth is a road that could take many forks. We don't know exactly what those forks are going to be. So I kind of advise my clients to think about, if you could plan your ideal labour and birth, what would that look like? But then also have the kind of a little bit of flexibility to shift and change these certain aspects if something unexpected were to happen or the plan needed to change usually for medical reasons. But I'd say a format, if you're putting together your own birth plan, which you can do in both public and private, would be making a bullet point list, concise, clear points of your main wants and wishes. Of course, in the two different systems, the environment will be quite different. So in the private system, you tend to be admitted to your delivery room straight away. That gives you a lot more flexibility, a lot more space to move around. Often they will come with baths attached, so you could use the water for pain relief. I would say in the public system, from speaking to clients, it does depend on who's looking after you. There might be somebody who's a little bit more traditionally trained, their practices might differ from certain things that you might want to do in terms of, like I said, hypnobirthing or delivering in alternative positions. So making these things very, very clear in your birth plan in the public system, I think, can be so helpful. Language barrier tends to be not so much of an issue, which is great because of the fact that actually the midwives and the doctors will do all of their clinical notes in English. So the level of English is very, very high with the people that will be looking after you, which I think is really reassuring. It's also important to note that the private system will only accept clients for delivery after 34 weeks. This being because majority of private hospitals, they only have a lower level of special care as opposed to neonatal intensive care. All the public systems do have access to this higher level of care. So if there were any complications that were to arise prior to this, or any, in the unlikely event of any preterm labour, before 34 weeks, then they would automatically, even if you were booked to deliver in the private system, they would automatically refer you to the public system for that higher level of care.
We understand that it's important to think of your specific needs before making a decision. What criteria should we take into consideration to choose between private or public?
A big thing we can take off the table is safety, because we know whichever route we go, you're going to have safe care, which I think is paramount. But obviously, there are great differences between both systems. So I'd say that one of the biggest factors is cost. The public system, if you're a resident of that country, the cost will be very minimal. The private system, yes, depending on your doctor, your room classification, your hospital, the bills will vary. The cost of that will vary. The majority of insurers, we find these days that they're imposing a cap. So they will cover the maternity care to a certain point, and then you will need to cover the rest of the cost yourself out of pocket. The communication element that we've touched on already is another big factor. So with the public system, I would say, what really has helped my clients, I see a lot of clients who deliver in the public system, education is so important, and managing your own expectations. So if you educate yourself on, by listening to podcasts like this, on what to perhaps expect and the differences between the systems and what the approach is like in the public, I think that's so helpful. Something that is also to take into consideration now is the fact that the coronavirus has imposed a lot more restrictions on birth partners being able to attend deliveries. And that has caused a lot of my clients over the last 18 months to switch from public to private, because during times where cases have increased, unfortunately, they have stopped birth partners from being able to attend at all. Naturally, the comfort levels are quite different between the two systems. So the public system, unfortunately, notoriously, the food is not particularly appetizing, but you can take in your own snacks, which we definitely recommend. And you will be sharing, if you're on the antenatal ward and the postnatal wards, you will be sharing with 6 to 8 women, depending on how busy they are. In the private system, they have different room classifications. So you have the option of a private room. Of course, that comes with additional cost, but there is that option there. And if you do opt for this, then your partner can stay with you throughout. So taking all aspects into consideration is very, very individual.
Yeah, I definitely agree. Thanks for the tips. It's very important to consider on an individual basis, I suppose, what costs, level of medical care, and even communication styles to ensure that expectations are met. So thanks again, Rosie.
No problem at all. Thank you so much for having me.
Thank you for listening to Abroad with Care. Make sure you subscribe to the podcast so that you don't miss out on any health-related topics. Your friends may have the same questions as you, and you can help them out by sharing this episode with them. Do you want to know more regarding health insurance? April International is here for you. Find out more information at asia.april-international.com.